in our Take Charge Managing Your Condition webinar series. My name is Kim Brooks. I'm the patient advocate and volunteer coordinator for the foundation. I also happen to be a CIDP patient. I would like to thank our corporate sponsors and private donors for their support. It is through your generosity that we can provide educational programs like these that will be sure to improve the patient's journey. Through our peer-to-peer support group meetings, we are frequently asked questions regarding diet and its effects on our conditions. I'm very excited to be introducing Dr. Terry Wahls. Dr. Terry Wahls is an Institute for Functional Medicine certified practitioner and a clinical professor of medicine at the University of Iowa, where she conducts clinical trials. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contribution in research, clinical care, and patient advocacy. In addition, Dr. Wahls has secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years. Dr. Wahls restored her health using a diet and lifestyle program she designed specifically for her brain, and now pedals her bike to work each day. She is the author of the Wahls Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine, the Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using paleo principles, and the cookbook, the Wahls Protocol, Cooking for Life, the revolutionary modern paleo plan to treat all chronic autoimmune conditions. Dr. Wahls will begin her presentation, then we will move into a one-on-one Q&A session. The questions for the Q&A have been sent in by patients registered for the webinar series. Thank you for your time today, Dr. Wahls. I will now turn it over to you.
Dietary and lifestyle approaches for stabilizing and often reversing complex chronic diseases, including multiple sclerosis and other neuroimmune and other autoimmune conditions. Here are my disclosures. I have completed funding from the National MS Society. I've trademarked the Wahls diet plans, the Wahls protocol. I have books that I have listed there. I have financial relationships with those entities. I own equity in those companies, and I own the website terrywahls.com. I'm going to discuss my story, and I want to be sure that all of you know that conflict of interest for the research that I do is managed by having a statistician who is masked to diet assignment that completes the statistical analysis of the data. They write a report of the findings and conclusions to the sponsoring organization and to the University of Iowa Conflict of Interest Committee. So we can be confident that what I present is unbiased research. So we'll go over my story, and I'm going to talk about the similarity between the central and the peripheral nervous system. We'll talk about the anti-inflammation diet, and then I'm going to review MS dietary research. And we'll talk about research from our lab and some recommendations for improving health. So before becoming a physician, I was an athlete. I competed nationally in full contact free sparring. I was a kick 'em up kind of girl. And when I got into medical school, I stopped competing in free sparring because I knew you should not let people try to kick you in the head. I completed medical school, I completed residency, had a couple of kids. I thought life was great. And then in 2000, my real education began. I became a patient. I developed left leg weakness, was stumbling. I saw a neurologist who, as he was going through my medical record, he said, "You have a prior history of visual dimming that was 13 years earlier." He sent me off to get an MRI of my brain, my spinal cord, lots of blood tests, nerve conduction velocities in my leg, in my face, and visual evoked potentials. And he said, and then I also needed a spinal tap and had abnormal spinal fluid. And the diagnosis was relapsing remitting multiple sclerosis. Now, being a physician, I saw the very best people I took the newest drugs. And MS is a circumstance where the immune cells are attacking the myelin, leading to acute episodes, worsening called relapses, and sensory disturbance, motor disturbance, visual disturbance. And that we have in the brain the epidermal cells that make the spinal fluid, astrocytes that transport oxygen and nutrients to the neurons. And those are the brain cells that we think of. Oligodendrocytes in the brain that make up the myelin, and the microglia that inspect the environment and deal with any threats. In the periphery, it's a very similar kind of structures. We have the neuron, and we have the end, it's called the axon terminal. And here it is the Schwann cell that is making the myelin. But it's really structurally very, very similar. And the types of conditions that are have neuroimmune is multiple sclerosis, which I have, transverse myelitis affecting the spinal cord, acute disseminated encephalomyelitis affecting the brain. In the periphery, we have Guillain-Barré, chronic inflammatory demyelinating polyneuropathy, mononeuritis multiplex, which, by the way, my father suffered from for decades before he died. And I want to make the observation that mental health issues also have acute waxing and waning, have evidence of demyelination, and have evidence of excess and inappropriate inflammation as well. And many systemic autoimmune conditions such as rheumatoid arthritis, inflammatory bowel disease, Sjogren's syndrome also have these neuroimmune problems. And we have similar comorbid problems that make things worse. Obesity, tobacco use, metabolic issues, so high blood sugars, fatty liver disease, insulin resistance, metabolic syndrome, and the presence of anxiety and depression accelerate disease course. All of these conditions and the things that have these comorbid problems have in them excess inflammation, strained mitochondria with a lot of oxidative stress, higher rates of leaky gut or increased intestinal permeability, and microbiome disruption. So we have too many of disease-promoting bacteria in the bowels. So the big question that you're thinking, like, so are peripheral nerves different than things that are in the spinal cord and the brain? In many ways, they are not. There's a poor diet is common in those patients, and nutritional insufficiencies accelerate the disease. And gut microbiome problems will contribute to the risk of disease development and disease severity. So improving nutrition will reduce the comorbid problems and will improve the quality of life. So back to my story. So my expert neurologist mentioned the work of Direct MS Charity, Ashton Embry, there in Canada, who was a great promoter of the paleo diet and of Lauren Cordain. Now, I'd been a vegetarian for 20 years. So after prayer, meditation, and reviewing the science that Dr. Cordain had published on his website, I adopted the paleo diet. I gave up all grains, all legumes, all dairy. The next year, I needed to recline wheelchair anyway. And by 2007, I am so weak I cannot sit up in a regular chair. And I also have trigeminal neuralgia, which are these intense electrical pains starting in my temple, shooting down to my jaw, that were made worse by stress and had been relentlessly worsening for 27 years. Now, fortunately, when I hit the wheelchair, I went and escalated my drugs. I took chemotherapy. When that didn't work, I took Tysabri, the latest new biologic drug. We all thought surely it would help. That didn't work. Then I was placed on Cellcept. And that is when I went back to reading the basic science. And I would begin to experiment on myself based on what I was learning. And I had figured out that the supplements I was adding, which were targeting mitochondrial function, were slowing the rate of decline. They helped my fatigue just a little bit, but and I was grateful for that little bit. I discovered the Institute for Functional Medicine. I took their course on neuroprotection, which was difficult because I was beginning to have trouble with brain fog. I had a longer list of supplements. I discovered electrical stimulation of muscles. I convinced my physical therapist to give me a test session. He said it was for athletes. He didn't know if it would help. I could grow more muscles, but he wasn't sure my brain could talk to those muscles. Plus, it was painful. And he knew I had a lot of MS-related pain. He gave me a test session, and he was right. It hurt like hell. But when it was over, I felt great. He said that was because of the endorphins. And so I began doing e-stim to as much pain as I could tolerate, and gradually was able to increase my exercise and my e-stim. And I should also tell you that I had a really big aha, and I'm actually quite embarrassed it took me this long to have this aha. What if I redesigned my paleo diet based on the nutrients, the basic science, and the Institute for Functional Medicine had identified as key to mitochondria and key to brain cells? And so I had this new way of eating starting in December 26th, 2007. And by the end of February, my physical therapist says, you're getting stronger. And I began walking again with 2 walking sticks. And on Mother's Day, I tell my family I want to try riding my bike for the first time in 6 years. And we have an emergency family meeting. Jackie has my big 16-year-old, 6'5" son jog on the left, my 13-year-old daughter jog on the right, and she'll follow behind. And I push off. My bike wobbles, but I catch my balance and I bike around the block. That big 16-year-old son is crying. My daughter's crying. My wife is crying. And I'm crying. And I cry even now as I describe that day, because that is when I understood that the current understanding of MS was incomplete. Because even though I had improved remarkably and was walking the neighborhood, as part of having a chronic progressive neurologic disorder, I had given up the future. And I didn't know what all of my progress meant. But the day I rode my bike, I understood that the current understanding of multiple sclerosis is incomplete, and who knew how much recovery might be possible. In October, my family signed me up for the Courage Ride, 18.5 miles. And once again, when I crossed that finish line, everybody's crying. My kids are crying, my wife is crying, I am crying. And this changes how I think about disease and health, and it will change the way I practice medicine and ultimately the focus of my research. So now I'm going to shift over into some MS diet studies. The observational studies show that MS patients have a terrible diet, just like the general public. We don't eat enough vegetables. Yeah, very, very common. And then in, again, observational studies of MS patients, we show that as you improve diet quality, there's better health-related quality of life and less disability. So, and I love the Dietary Inflammation Index. This is a scoring system that looked at nutrients that, according to the basic science and in human studies, that these nutrients either improved or the anti-inflammation producing cytokines, or the what effect they had on the inflammation associated cytokines. And those are the molecules in our bloodstream. So the key minerals were iron, magnesium, selenium, and zinc. The vitamins were vitamin A, retinol, the B vitamins, vitamin C, D, vitamin E, the fats, and the trans fat is an anti-nutrient. If you have too much of that, that's really terrible. The orange color, or rather the reddish color, these are carotenoids, polyphenols associated with more health. The gold are the spices that were the most potent at improving health. And then a moderate amount of alcohol was protective. A high binge drinking, or more than 2 drinks a day for men, more than 1 drink a day for women, was harmful. Caffeine is protective. Green and black tea are also protective. Again, it's been used in hundreds of observational studies, and the scores range from negative 8.87, so anti-inflammatory. And these include the Mediterranean diet, the MIND diet, paleo diet, and the Wahls diet patterns. And the most inflammatory diet are high in added sugars, processed foods, and it's the standard westernized diets that we eat here in the United States and you are eating in Canada. And the DII score correlates with risk of all of these health problems, including autoimmune and neuroimmune problems that are both central nervous system immune problems and peripheral nerve immune problems. So we originated as a species in equatorial Africa. We separated from primates about 6 million years ago. Our genus Homo was identified 2.5 million years ago. And our species, Homo sapiens, 250,000 years ago. We met the Neanderthals in Northern Europe, in the Middle East, 100,000 years ago, had a 100,000-year war, and then we assimilated the Neanderthals into our DNA. So we all have about 2 to 5% Neanderthal DNA. And then we began migrating into the Middle East, Asia, Australia, the Pacific Islands, North America, and South America. The reality is we thrive with diverse dietary patterns because we have been successful in the tropics, the temperate zones, these Arctic zones. We've been successful in rainforests, grasslands, and deserts and forests. We are successful in the islands. We can eat a wide variety of things. And this is a glimpse of the family farm that I grew up in Northeast Iowa. We had cows, pigs, chickens for family consumption. Okay, so many diets are anti-inflammatory. There is no single definition. There are some common themes that we can identify from the studies that I've shown you already. Diets that stress fruits, and particularly non-starchy vegetables. They stress whole grains over flour-based products. They encourage spices, diversity in the plants and protein sources. They're high in fiber. They encourage fish and encourage olive oil. They minimize added sugar, refined oils, processed foods, and fast foods. They limit alcohol. They don't necessarily eliminate alcohol. Here in the United States, many don't know how to cook. Over a third are eating fast food on any given day, and the younger you are, the more fast food you are eating. So I tell my patients, reduce and preferably stop added sugars, processed foods, fast food, and refined oils. Have more vegetables, more non-starchy fruits. Have more fiber. That will produce the short-chain fatty acids known as butyrate. Have more fermented cabbage and kefirs, sauerkraut, kimchi, yogurts, and kefirs. Avoid the high glycemic carbohydrates. That's whipped white potatoes, white breads, white pastas. Have more healthy fats, nuts and seeds, fish oil. Encourage olive oil. Be sure you're having sufficient protein. If you're vegetarian, that's legumes and whole grains. For the micronutrients, go out and get sunlight, some liver for the vitamin A, that's pre-made, retinol, vitamin E's and nuts and seeds. Vitamin C is destroyed by heat. So more sauerkraut, kimchi, great source of vitamin C. Greens, if you have them raw, citrus and fruit if you're having them raw. And the B vitamins, liver, greens, and whole grains. Minerals, zinc, so shellfish and liver, mushrooms and beans, iron, liver, beans, and greens, copper, liver, nuts, leafy greens, selenium, Brazil nuts, liver, nutritional yeast, whole grains, sea salt, and seaweed for the iodine and trace minerals. And for those polyphenols, spices, cocoa, berries, nuts, and vegetables, particularly the non-starchy vegetables. Carotenoids, those are things that are deeply colored. Beets, berries, peppers, carrots. If you're vegetarian or vegan, you're at risk for developing low B12, an imbalanced omega-3, omega-fat ratio, inadequate protein. Be sure you're combining legumes and rice. I encourage taking B vitamins and consider an omega-3 supplement. Consider fish oil if you're open to that, or a DHA alga supplement if you are not. So again, there are many anti-inflammation diets. So key mitochondrial nutrients. This is a theory put out by Bruce Ames that a low micronutrient intake may accelerate the degenerative disease processes of aging via mitochondrial strain. And this includes autoimmunity, neuroimmune, whether it's central or peripheral, and neurodegeneration that's seen with cognitive decline and Alzheimer's. So we're talking about zinc, magnesium, biotin, which is a B vitamin, and the fat-soluble vitamins K, D, and A, lipoic acid, and acetylcarnitine. And there's a higher risk of increased intestinal permeability, that's known as leaky gut. And that increases the risk of abnormal immune activation and the development of autoimmune processes, and also of cancer. It will increase the risk of developing food sensitivities and excess immune response to food proteins. And you can see these black dots that should stay in the lumen of the gut, get into the bloodstream, and will then activate the immune cells, the innate immune activity. Things that lead to leaky gut: extreme exercise, concussions, non-steroidal anti-inflammatory drugs such as ibuprofen, aspirin, acid blocking medication, prednisone, and oral contraceptive tablets. The emulsifiers and surfactants that are in processed foods and fast food, alcohol, a high-fat diet, smoking, and age, over the age of 50, which is looking younger and younger every day to me. Improve the gut barrier by having more zinc, more vitamin A, more essential fatty acids, more glutathione, and more short-chain fatty acids. Diet, so it makes sense that we know diet is so important that we should do dietary intervention studies to answer this question. But they're hard to do, folks. We're asking people to give up familiar foods, eat new foods with unfamiliar tastes, cook new recipes, create new menus, and they will probably create foods that are now excluded. Plus, I've already indicated a lot of people don't know how to cook. And they will get social, family, peer, and work pressures to keep eating these now excluded foods. Now I'm going to flip over into some of the research that we've done. So this very first study, which was nutrition, neuromuscular electrical stimulation, and secondary progressive MS. This study was conducted based on the protocol I used for my recovery. And we got funding for the very first study by Ashton Embry's group, Direct MS Charity, which is based there in Canada. So I'm very fond of what the Canadians have done for my research. It was a single-arm study that's known as a safety and feasibility study. Can people do this? That's the feasibility. And the safety is, do we cause any harms? We had blinded assessors that did the assessments. So they were unaware of any interventions. And we're asking again, could other people do my interventions? Because I did a whole lot of stuff. And was it safe? And then we wanted to know what the effect was on fatigue, quality of life, motor function, mood, thinking ability, and blood lipids. We asked people to stop gluten, dairy, and eggs, and to eat more green leafy vegetables, more deeply colored vegetables and fruits, and more cabbage, onion, and mushroom family vegetables. We encourage grass-fed meat, wild fish, and liver. We want liver once a week. And we want them to improve the quality of their food according to what they could manage given their financial reality. We encourage fermented food, sauerkraut and kimchi, seaweed, nutritional yeast, and algae in the form of chlorella. And this is what that looks like. That's an elderberry smoothie on the top, big salads. Those are lamb chops, cooked greens, Brussels sprouts. This was a very dangerous diet. People were very concerned in my institutional review board. That's the group that oversees research. So we had to do a preliminary study looking at my diet, and we compared the nutritional intake of my diet compared to that of the other 50-year-old women in the United States. The blue bars are my diet, the maroon bars are the US diet. So the IRB, and by the way, the dietitian who did this study said she'd been doing dietary assessment for 35 years. And she said this was the most nutrient-dense diet she had ever analyzed. We also gave people methyl B12, methylfolate, vitamin D, and fish oil. So greens color cabbage, onion, mushrooms. Grass-fed meat, wild fish, liver once a week. We taught them mindful meditation, taught them stretching and exercises targeting their butt and legs, back and belly muscles. And we taught them how to do electrical stimulation and gave them an electrotherapy device. The big risk was that if you're overweight or obese, you lost weight without being hungry. And people lost weight rapidly. And then the weight stabilized at a weight that they were at in their early 20s. In fact, we had so much weight loss, such rapid weight loss, I'd have to file reports with the IRB every 6 months in terms, and we had to notify their primary care team regularly that the patient had lost weight so they could look at them and see, was there anything else going on? One had to withdraw at 6 months due to continued cognitive decline. And that is part of what you expect with the disease course with progressive MS, that cognitive decline is common and worsens over time. The box to the left of the slide, people had 1.5 servings of fruits and vegetables a day, and about 5 servings of gluten, dairy, and eggs every day. They radically changed their diet and sustained that. In a public health measure, anyone who increases the fruits and vegetable intake by 1 serving that's maintained at 12 months is considered a tremendous success. To maintain this pattern, we see that in the setting of adapting the diet reduces symptoms acutely. Abandoning the diet leads to recurrence of symptoms. And so this graph alone would let you know that likely people are experiencing improvement in symptoms, and they will probably tell you that if they slip up on their diet, they feel much worse. The graph on the right talks about that people are exercising and they're adding electrical stimulation of muscles. And remember, these individuals have progressive MS. The average depth of disability is between cane and walker. So these folks are severely disabled at entry into the study. The top 2 lines are the short form 36 general health and energy. So we've improved general health and energy by 14 to 17 points. 5 points is clinically significant improvement. Fatigue severity scale score drops by 2.38 points, so lower scores are better. And clinically significant change is 0.45. So this is a relatively large level of change. And the improvement in energy, general health, is highly correlated with the reduction in fatigue. This is a look, another look just at fatigue, and the fatigue change drops very sharply from 0 to 3 months, but continues to decline over the next, the remaining parts of the study. And then people get worried because I tell people to eat meat, like, oh my God, we're gonna wreck their cholesterol. What I'm showing you here is how the body mass improves. So that's a measure of weight. Total cholesterol reduces. The HDL triglyceride ratio, which is correlates very strongly with insulin sensitivity, that improves. And the HDL cholesterol, which is associated with better heart health, less cognitive decline, less severe disability in the setting of MS, that improves. This is a look at the Beck Anxiety Index, Beck Depression Index. Again, lower scores are better. So anxiety declines sharply at 3 months and stays low, and depression scores decline sharply and stay low. Verbal and nonverbal reasoning, so that's spatial orientation, that improves steadily over time. Again, if you remember, I said cognitive impairment is common with progressive MS, and it worsens over time. You anticipate a 10 to 20% worsening every year. So the improvements that you see should be seen in the context of what you would predict would be a 10 to 20% worsening year by year. Then we looked at an association between eating the recommended foods, avoiding the excluded foods, and the effect on mood, the effect on cognition, and the effect on fatigue. So there's a very strong association between the two. You got to eat the right stuff, avoid the wrong stuff, and you're more likely to have a better outcome. The factors associated with success was less disability, a shorter disease duration, the more of the intervention that you could do, family support if you're doing the diet, and the more exercise and the more E-stim, you'd have a bigger change in your gait. And that's a picture of me and my Appaloosa horse, Stormy, my cousin, Sarah, and my dad, who was just beginning to get symptomatic with the mononeuritis multiplex, and he would be beginning to develop restless leg syndrome. And that would become progressively more severe over the next 20 years for him. So we did a couple more clinical trials. In 2016, we started our 4th clinical trial, which I said was funded by the MS Society. It was the SWANG, which is the low-fat diet, low saturated fat diet. We stressed 4 servings of grain. We wanted whole grain. I had 6 to 9 servings of fruits and vegetables. We eliminated grains, nightshades, dairy, and eggs. It was a randomized parallel group. We looked at the modified fatigue severity scale, the quality of life scales, a 6-minute walk test for meters walked. So it's important that you know that we had the observation periods. People came in, they got all of their assessments. We asked them to follow their usual diet, come back in 12 weeks. We repeated all the assessments. That would tell us that the interventions, that these measures were stable. They got randomized. They were either on the Wahls diet or the SWANK diet. They came back at 12 weeks, repeated the assessments, came back in another 12 weeks, and repeated the assessments again. These are the control variables. These are the clinical factors that contribute to disease worsening. This is statistically letting you know that the 2 groups were similar. Now, the observation period again was stable for all of these measures. The primary outcome was fatigue severity scale, and both Wahls and SWANK, statistically, they are the same. The modified fatigue impact scale, which is a more sensitive measure, Wahls is significantly better than SWANK at 12 and at 24 weeks. And the quality of life, SWANK and Wahls both improve significantly. But again, statistically, Wahls and Swank Wahls is clinically and statistically much more improved than the Swank group. The red bar is the clinically meaningful difference between the two groups. So if you can get past the red line, you have clinically significant improvement in fatigue and in the physical health quality of life. Okay, and then this time we're looking at the mental health quality of life. Swank achieves clinical significance, although, and it's statistically significant at 24 weeks. Wahls is clinically significant at 12 and 24, and statistically is more significant than the Swank group. The 6-minute walk test, neither group improves much at 12 weeks. And that's not surprising because we asked them to not add an exercise program. At 24 weeks, the Swank really hasn't improved. Interestingly enough, the Wahls group has remarkably improved. And it's clinically significant, statistically significant. It's not statistically different than Swank. The p-value is 0.08, so there's a trend towards clinically or statistically different than Swank. Simple digit modality is working memory. It's a measure of cognition. Swank is better than Wahls at 12 weeks. Swank and Wahls are equivalent at 24 weeks. And so what I want to tell you is, if a low-fat diet speaks to you, do a low-fat diet. If the paleo diet speaks to you, do the Wahls diet. Make it more affordable. 20 to 40% of the groceries we buy are thrown out. You could have vegetarian meals with beans and rice. You could do hunting, fishing, gardening. Meal plan for the week around your protein and vegetables, and grocery shop planning for recipes. So make it easier. Sit to chop your vegetables, batch cook, plan for leftovers. And the Wahls for Cooking for Life has some great tips for implementing the Wahls diet. One-pot meals, skillet protein plus vegetables that are added the last 2 minutes. Slow cooker meals, attend a cooking class. Making habits is hard work. Drop it down to small, achievable steps. Get daily prompts. We have partnered with a company in Canada, Master Health, to make the Wahls protocol mobile application. If you go to masterhealth.care/get-Wahls-show notes, you can get the mobile application. It's a tremendous tool. I worked closely with him to design this. Again, there are many, many anti-inflammation diets. Are peripheral nerves different? No, not really. We share a lot with the spinal cord and brain-related immune problems. Everything is connected to everything else. Address the system. Think about your food, your environment, chemicals, sleep, movement, stress, safety. Changing dietary patterns is really hard work, folks. Sugar and processed food is addicting. Technology is addicting. I tell my patients to think about the why to make the change. That family farm, when my dad died, we decided to begin replanting that farm back to trees. So we started the process in '95. We planted this field in '98. just as those trees will grow up, those kids grew up. This is my daughter, and on Mother's Day, which is the first Sunday in May, my kids plant flowers and vegetables for us for Mother's Day. My son grew up, and now he's way taller than me or Jackie. And back to that, our fields that we planted to black walnuts and nut oaks. 20 years later, the understory has come in. We didn't plant any jack-in-the-pulmits, but they came in. Berry bushes came in. Ferns came in. And we now have a forest. It took a while. The first 5 years, all we saw were what looked like weeds, and then the trees topped the weeds, and the forest began to emerge. So we have our research papers and examples of the gate videos at terrywahls.com. Research papers, I encourage you to go there so you can see the inspiring levels of gait change that half of our people were able to achieve. We have a one-page diet handout at terrywahls.com/diet. There is a wonderful documentary, Define All Odds, about my healing journey at defineallodsmovie.com. Sign up for my newsletter, the documentary. Follow me on Twitter, on Facebook. Follow me on Instagram. You get to see what I'm eating at Dr. Terry Wahls. You see what I'm eating. You get inspiring stories. You see my garden. It's really quite wonderful. And with that, I'm going to stop. And we'll take some questions.
Great. Thank you, Dr. Wahls. That concludes your presentation and brings us into the Q&A. Let's begin. The first two questions have two parts. One, for fatigue and brain fog, are there certain foods that should be avoided or included?
Okay, so the first thing I want to remind everyone is this is education, it's information. I'm not creating a medical relationship with anyone whose question I'm answering. So the key thing for fatigue, brain fog is get rid of the sugar, processed foods, eat more protein and more non-starchy vegetables.
There's a part B to that, which is sometimes we are placed on medications that create some of these symptoms, but we need the medications. Can the foods we eat can counteract that negative side effect?
So the medications, depending on the meds, can add to more fatigue. It can add to a wide variety of unpleasant side effects. Improving your diet, improving your self-care will always be a key part. And what I've observed in my clinical practice and in my clinical trials is that as people improve their diet, their comorbid problems often reduce. We're able to reduce many medications, occasionally discontinue meds. And we see, again, with a wide variety of autoimmune problems, that as people go from highly effective, very potent disease-modifying drugs, they can go to less potent disease-modifying drugs that often have fewer side effects, and then to lower potency drugs with fewer side effects, and then to off disease-modifying drugs entirely. And often their other medications that they were on are being reduced. And I have seen people in the VA go from 25 drugs to 10 drugs to 5 drugs to no drugs. So yes, there's plenty of reason to be optimistic.
Okay. For pain management, are there certain foods that should be avoided or included?
Okay, this is going to be again and again and again, I'm going to be saying the same thing. Whether you got pain, you got brain fog, you got low mood, you got to quit the junk, quit the processed foods, quit the fast foods, eat more of these radical things known as non-starchy vegetables, have plenty of protein and healthy fats.
Okay. And the part B for that, for patients that are on pain medications, are there foods that would help or hinder those pain medications? And are there foods that actually trigger pain?
There are foods that trigger pain. They're known as sugar, a lot of added sugar, processed foods, fast foods. If I had gluten, dairy, or eggs, that will, in 6 to 8 hours, occasionally somewhat longer, trigger my trigeminal neuralgia. And I will have incapacitating pain that is so severe I cannot talk. And so I'm very careful to avoid exposure to those foods. Now, depending on the individual, they may be a very different set of foods that are their triggers. And so if you're coming to work with me, there are a variety of things that we would do to help identify, do you have any specific triggers for you? Once again, you got to stop the added sugar, processed foods, fast foods, and eat more of these radical things known as non-starchy vegetables and sufficient protein and healthy fats.
Next, I am a CIDP patient of 12 years. In addition to permanent nerve damage, I'm dealing with reduced kidney function. Specifically, I need to limit my potassium intake. What would be your recommendations for diet and nutrition?
Again, I have to remind everyone, I cannot be giving specific medical advice. So I'm going to generalize this. And I'm thinking of a patient who had type 1 diabetes, who had pulmonary sarcoidosis, was in intensive care units, had declining kidney function, and was told that she would soon need dialysis. So a very, very sick individual whose neighbor had heard me speak at my very first public discussion where I was telling my healing story and my recovery. And their neighbor came to Julie and her husband, said, "We heard this amazing talk. I know that life is so busy for you. We will cook for you." Like, what loving neighbors. So they cooked based on the concepts that all of you just learned today. And Julie had her pulmonary sarcoidosis melt away. She no longer needed the high steroids. Her kidney doctors were like, "I don't get it. Your creatinine's getting better and better. And no, you're not going to need dialysis, at least not now." She still needed her insulin pump, of course. And she did remarkably well. So by all means, talk to your medical team. You'll need healthy fats, you'll need plenty of protein, you'll need some non-starchy vegetables, but your medical team can help guide that. What you have to do is you got to stop the sugar, processed foods, fast food, and eat vegetables, protein, and healthy fats. And your medical team can help you sort out what is the correct amount of vegetables for you.
Okay. In your research, have you seen regrowth or recovery of patients with axonal nerve damage, or would it be strictly myelin sheath?
So the basic science induces a wide variety of disease states, whether it's peripheral nerve, spinal cord, or brain disease states in animals. They give the intervention to half, and then after a defined period, they kill the animals, and then they could measure very specifically, is it myelin, is it axon, is it cell body change, is it mitochondrial change, and then they know very precisely. For me to know that for a patient, I'd have to kill them and do an autopsy. I'm not going to do that, folks. So, and I'll also tell you that my neurologist, when he did the MRI, he was so thrilled the day I came in walking. You know, there was like this, it was stunning success. He did another MRI, and he thought we were just going to see everything having melted away, and nothing had changed. And then it came back to, well, of course nothing's going to change. Those are old lesions. I've not had new enhancing lesions in many years. So what clearly I had done, so, clearly you have bypassed, you've created through neuroplasticity new pathways around the previously destroyed lesions. He was a very wise neurologist. He said, what really matters is function. Is your pain less? Is your mood better? Is your fatigue less? Are you walking better? And the answer is yes to all of those. That will always trump whatever we see on your MRI is your function.
Do you have an occasion where you break your protocol? And if so, how does it affect you?
Never intentionally, folks. If I came to your house, Kim, and you were not meticulous in how you prepared your food, and you accidentally got me gluten, dairy, or eggs, I would have this flare of the trigeminal neuralgia. When it turns on, it can go from a little bit uncomfortable to devastatingly horrible within a few hours. Once it's turned on, really on, light triggers the pain, sound triggers the pain, a breeze on my face triggers the pain, swallowing triggers the pain, talking triggers the pain. So I am drooling, not talking, in a dark room, and I'm taking prednisone to try and get things stopped. And if the prednisone is not enough, then I have to go in for a really high dose Solu-Medrol. I assure you, I never will willingly break my protocol because of the intensity of the suffering. And my family would never intentionally allow me to get food that has the potential of having gluten, dairy, or eggs because they have seen the level of suffering that I endure.
Okay. What are your thoughts on lion's mane mushroom? And are there forms that are better or recommended?
So if you'll remember from my lecture, I talked about that mushrooms are a part of my protocol. There is a growing body of research that mushroom consumption is associated with less anxiety, less depression, less cognitive decline. And so I recommend mushrooms. I want you to eat mushrooms according to what you can find that are culinary. If you know your mushrooms well, you can go forage for them. You have to know your mushrooms well because there are poisonous ones that can kill you. And there are a variety of mushroom products. There are powders that are grown, and then you get mycelium and the grain that was grown in. So you have to be careful of what type of grain that was in. You can get extracts that don't have any of that grain associated, so that may be more beneficial. I think a variety of mushrooms are beneficial. Lion's mane is great, but it's not the only mushroom that's been tested for facilitating nerve growth factor.
Okay. Now that your research has branched out to include other conditions, have you ever included a GBS-CIDP, MMN, or variant patient? And if so, what was the response? And if not, would you consider?
So if you guys want to fund that research, we're happy to conduct it. So because I want to pay my staff, I can't do research without paid staff. That means I have to have funding to do that kind of research. But if you'd like to fund, and you might start with funding a small clinical trial that we could do a single arm safety feasibility study. You could pick a disease state, and yes, we'd be happy to do so. And so, Kim, I'm happy to chat with your organization afterwards.
Okay, that sounds great. As someone that cannot afford a complete dietary shift at this time, would there be a benefit in removing or adding certain foods as an initial step?
Okay, so you've heard me go over this concept time and time again. Well, I want you to quit throwing away groceries that you don't consume. So menu plan, meal shop, plan for leftovers. So that's a great first step. Go find people who garden, hunt, fish. That will help. And then quit eating things that are terrible for you. So get rid of the added sugar, get rid of the processed foods, eat beans and rice, if that's, and onions, cabbage family, according to what you can afford. And I use these concepts in my veteran affairs clinics at the VA. We took care of people living on food stamps, so on disability, very limited resources. And we taught them meal planning, shopping, and how to plan for leftovers. And they implemented this stuff successfully, transformed their lives, improved their energy, improved their mood, reduced their pain, reduced the number of meds that they needed. And some of these folks even got back to work.
Okay. Do you see a difference between real food consumption rather than a pill supplement?
Holy shit, yes. So supplements should be supplemental to the foods you eat. And if you eat food, if you eat kale, for example, easy to grow, very tough, tough to kill. It just needs dirt, sun, and there are so many more nutrients in the kale than there will be in a sulforaphane capsule. So eat the food. And that's just so much more important than taking the capsules.
Okay. As part of your research, candidates were required to use a TENS machine. Why is this included, and is it a specific type of TENS machine?
So it was, my journey is remarkable in that the University of Iowa, and I was a part of the institutional review board, they saw me walking, then becoming severely disabled in a tilt-recline wheelchair. And I'd been on that institutional review board for 6 years, or 4 of which was in the tilt-recline wheelchair. And then I come walking in. So they saw this amazing transformation. My chair of medicine saw this amazing transformation. He became the dean of the College of Medicine. And he called me and said, I want you to do a safety and feasibility study. And so it took me about a year to write up the protocol. And we got some funding from you Canadians, so thank you. And the IRB said, no, it's not safe. There's no animal data. You're just it. And the dean wanted my study to happen. He apparently called the chair of the IRB and said, you figure out what it will take for Wahls to get approval. So I met with the Pharmacy and Therapeutics Committee, we chair, and we had more stringent exclusionary criteria who could get in, more stringent lab monitoring, which made it, by the way, quite a bit more expensive. And we're able to do the study. The IRB said, you got to do exactly what you did, Wahls. Exactly. Electrical stimulation of muscles was a big part of my recovery, so that was in it. We had a paleo diet, very precise one. That was in it. We had a complicated supplement regimen. That was in it. I did a daily meditation. That was in it. The review, so we did that. We had great results. I could not get it published because all the reviewers like, very messy study. What worked? What was the mechanism? So it took me another 1.5 years to find a journal that was willing to publish the study. I've not been able to get the NIH, other big foundations to fund that complicated study for those reasons, because like, what's the mechanism? On the other hand, Because I've had great success with individual patients who see me, some of whom have significant resources. They have funded us so we could do more complicated studies. So we have done recently a very interesting study that was multimodal like this, and we're cleaning the data. We'll probably be submitting that for publication sometime this winter. But it's because I'm able to do these studies funded by private foundations in private donors. And that's what it will take, because the National Institutes for Health here in the United States want to fund studies that look at one molecular pathway, which are great for making a new drug, but are not very good at creating health.
Okay. As we age, our strength naturally declines. This seems to be increased with autoimmune conditions. How would you approach change in order to regain and preserve the highest level of function in this population?
Strength is not supposed to decline as we age. We're supposed to stay physically active, strong, doing real work. And if we do that, strength declines do not occur. Again, it's the same things I've been telling you all along. Eat vegetables, get sufficient protein, high fats, and then exercise. And if you're severely disabled, it will be a gradual process, and we take our people through that. But you have to do it in a slow, gradual way so we don't overtrain.
And also in your research, you added meditation. And why is this important to you?
Well, it was a key part of my self-care that led to my recovery. It was written into our first protocol for the reasons I already mentioned. I was required to copy what I did. There's a large amount of research that meditation improves myelination and reduces microglia activity, reduces the damage in the brain, spinal cord, and I presume also in the peripheral nerve. Plus, it's free.
Exactly. Would this diet protocol help a person recover from muscle stiffness and weakness in hands and wrists?
So stiff man syndrome is probably an autoimmune, so this would be helpful. Physical therapy is necessary for those who have a acute traumatic injury. So certainly I'd want someone to work with their physical therapist.
Okay. Well, that actually ends our Q&A session. And that concludes our session today with Dr. Wahls. On behalf of the foundation, our patients and their families, I would like to thank you. We have learned a lot today, and I'm sure the Wahls protocol will continue to be a part of our discussions on future support group meetings. We wish you continued success on current and future and research, and as one patient to another, good health. Thank you so much, Dr. Wahls.